generic medications, or there are natural products that are not patented. So that the pharmaceutical industries have looked at these drugs and said, absolutely no way are they going to invest any money in them. The problem is that the government, which is the sort of source of financing for the development of new medications, novel medications, they're so invested in promoting the anti-drug message that they're not willing to fund research into beneficial uses. And then the major foundations that normally do that are also not willing because it's too controversial. So if we want to develop psychedelics and marijuana into medicines as a strategy to end the drug war, we can't rely on the traditional approaches. So it was clear to me that after I was involved in the lawsuit against the DEA when they tried to criminalize MDMA back starting in 1984. And we were able to win the administrative law judge lawsuit, but it was only a recommendation to the head of the DEA about keeping MDMA available as a medical use. And the head of the DEA rejected the recommendation. We sued back and forth. We won a couple times. In the end, we lost. And what was clear is that the necessity was to mobilize those people that are sympathetic and create our own nonprofit drug development organization. Particularly motivated starting initially with MDMA, and then we've moved on to marijuana. Now, in order to do that, it really takes large amounts of money to develop a drug into a medicine. On the other hand, we have an enormous advantage in that it's the Aikido strategy, where you use the energy of the opponent against them, so that if we take drugs like marijuana, MDMA, LSD, that have been demonized, and have enormous amounts of research funded by governments into why they're bad, then the risk profile of these drugs, which can cost hundreds of millions of dollars to establish, is already done. So we just need to summarize the current research and then focus on developing beneficial uses. Now, for me, one of the more useful tools in my life has been marijuana, and particularly when I'm stuck. So that I was planning this whole career in clinical psychology to be a psychedelic therapist and to do outcome research, and there was a point where I couldn't get into graduate schools, and I was figuring my life, I didn't know where it was going to go, and so I smoked some pot, and I got this idea, like many of us, we want too much too fast, like a classic kind of thing. So what I wanted was to do the research, but the politics was in the way. And so I said, well, maybe I should study politics. So that's what led me to go to Harvard to get in there as their token hippie of the year. So I'm a benefit of affirmative action. Very much support that. And so the arc that I tried to make, which is from a criminal, counterculture, criminal, drug user, draft resistor, to kind of mainstream, just take it for granted, is what I think we need to do with marijuana and psychedelics as medicines. And we're sort of halfway to there. So that briefly, with marijuana, we're nowhere. And the reason that we're nowhere is because the federal government has, in the United States, and also here in Canada, has a monopoly on the supply of marijuana that can be used in research. Flick talked to you about the research that he did. He showed you stuff about different strains and what they do. Health Canada will consider none of that in any kind of effort to make marijuana into a medicine, because the marijuana that he used was not grown under government approval. So none of that counts. The monopoly that the United States has is something that we've been challenging in courts since 2001. And depending on what President Obama, on the kind of person that he appoints to be the head of the DEA, we may be able to break the monopoly fairly soon. But because we cannot choose our own marijuana, because we don't get it to look at benefits, government will only give it to risks, there really is no research going on into medical use of marijuana that can make it into a medicine. There's 13 states that have approved medical marijuana, hundreds and hundreds of thousands of people are using it. Again, none of that data counts. None of the marijuana is used grown under medical, under DEA approval, so that the effort to make marijuana into medicine is going nowhere. With psychedelics, it's a whole different story. Surprisingly, there's lots of manufacturers that have DEA licenses to produce psychedelics. I mean, you need to train dogs to sniff them at the airports, you need to do all sorts of things. So there's a lot of people that have business in making these psychedelics outside of the government monopoly. So we've been able to access these drugs. And the FDA in the United States, and now we've just found out with Health Canada that's approved our MDMA study here for post-traumatic stress disorder, which is the first psychedelic research in over 35 years in Canada, that the FDA and Health Canada put science before politics, at least to some degree. And that's again this key of of drugs and healing, is if we can get to the people that look at these things from a scientific lens, more so than the politics, that's where we'll make progress. So that over the last 20 years, we've had a renaissance in psychedelic research. So those of you who are sort of coming of age at this particular time, it's like the early 60s in a way, or the late 50s even in terms of psychedelic research. We've gotten this 40-year wandering in the desert, the researchers, or we're now at the promised land, just about crossing in, and we've got psychedelic research approved in all sorts of countries, and we're probably going to get it approved in Jordan, in an Arab country. We give MDMA to people who speak Arabic and for PTSD. So that this renaissance has been supported by this pent-up interest among scientists and clinicians and healers in trying to explore the therapeutic use. So I'll just leave you with that. We can talk more specifics. We've got MDMA PTSD studies going in the United States, Switzerland, Israel, Jordan, about to become Canada. We're waiting to import the MDMA from Switzerland. We have a study in Spain. We've got LSD research that's going on for end of life. So there's three main streams. One is MDMA for post-traumatic stress. The other is psychedelics for the end of life, because we have to pick patient populations people are sympathetic with. And then the last one is the treatment of addiction. And that's the hardest. Because it's the most sort of demonized patient groups, they need the most support, and we'll hear more about that from Gabor, but it's something that is a necessary part to show that we're also responsive to the problems of drug use. So we'll talk more about it later. Thank you for listening.